The country's health minister painting a grim picture of the challenges within his ministry that seeks to serve the medical needs of this country. Jimmy DeSwain has more from his contribution to the mid-year budget debate.
Mounting bills was the theme in the Minister of Health's contribution to the mid-year budget debate. The Public Hospitals Authority, he says, found itself saddled with a number of bills for facilities outside of its remit.
So imagine a $6.6 million facility. The carrying cost for that facility, the staffing cost for that facility, the security cost for that facility, the cleaning cost for that facility, to see one patient an hour on average.
That was the health minister speaking to the costs associated with the proposed clinic for Smiths Bay, Cat Island. Sands said recommendations by the technical team were not adhered to, although the member for Cat Island, Romkey and San Salvador, Philip Davis, refuted Dr. Sands' claim.
It is my understanding and what I know to be fact that each of those clinics were what was recommended by the technical team.
Still, that was not the only project for which the PHA assumed responsibility. Dr. Sands cited another proposed facility that would draw heavily from the public purse. This time around, it was earmarked for Eleuthera.
It is nothing short of a national disgrace what has been done. We have dug a massive hole in Palmetto Point.
$27 million blue hole or what?
Supposedly to put a $27 million hospital that there is no chance in the near future we will be able to afford.
So great was the financial burden, the PHA was forced to draw funds from another source.
And we required $10 million from the National Health Insurance budget in order to ensure that the public's health could be maintained through the Public Hospital Authority.
As if the financial challenges were not enough, the health minister said the country is facing a national crisis with nurses.
When I gave my budget presentation, I would have said that we were short roughly 440 nurses. I am sorry to report to the Bahamian public that that number, just since that presentation was given, we now have a national shortage of just over 650 nurses.
Only midway into its budget, the Department of Public Health has spent a whopping 84% of its budget. The PHA has spent 96% of its $41.6 million budget allocation. Jimmy DeSwain, ZNS Network News.